Because of my background and training, one of the things that I do is have an initial conversation with families, but beyond that is I really do a deeper dive into any medical records that they have, psychological testing for their loved one, so that I can make a determination whether it's a good fit for us and whether we are able to handle this case. And so in so doing, you need to look at all the family dynamics, the identified patient's diagnostic profile, and getting a better understanding of the case itself. And that's kind of how we get started in the work that we do.
When I first take a call with a family, the most important thing to me is to let them vent. Let them get it all out. Usually we're one of the last resorts, that they have tried so many things on their own that hasn't worked. So they're very emotional. So just letting them get it out and tell me their story and tell me about their loved one. And just to assure them, unfortunately, this is common and they're not alone, and we will do everything that we can to help their loved one and their family get through the process.
One of the things that we bring to the table is, because of our background and training, we can handle a multitude of different types of cases. One of the things that makes the difference between somebody who may be a little less ethical than others is making sure that you are equipped to handle the case. Oftentimes, we get calls from families after they've had experiences with others, and this is not a criticism of anybody else, just to say that understanding what the makeup of the diagnostic impression is and the dynamics of the family to understand whether this is a case you should take. The other issue that can come up is geographical location. Sometimes cases may call us from other countries or parts of the country in which we may have colleagues. I believe that part of being ethical is having three things: mentorship, supervision, and really good collaboration with other people around the country, so that if it's a case that makes more sense for somebody else we're connected with and collaborate with, that we often will invoke those people. The last thing I'll say is, in understanding a particular diagnostic profile, sometimes it's necessary to bring in teams of people so that we're not operating on an island. And so one of the things is to make sure that we have the proper fits. So if we have somebody who may be a female and they need a transport or a companionship or something else, it may not be a good fit for me, possibly for Jen, but oftentimes we will collaborate with other people around the country. I think that is probably the single best way to make sure that you are keeping your ethics.
I think it's very important when it comes to ethical interventions to make sure it's something that we can handle and something that we are knowledgeable with. If it's not, we have no problems referring that person. For example, if it's somebody that has a severe eating disorder, if we're not comfortable with that, we do have people around the country we work with that specialize in eating disorders. So we can either bring them on as part of our team to help them through the process, or just refer them straight to them, because we want to make sure, not only we're doing our best for the family, but that we're not causing any harm.